A neck lift procedure is a very specific procedure that really targets the lower jawline and the neck. It doesn't do anything to the mid-face or the cheek area. That's when you start extending into a full facelift. So a lot of patients come in and they're really concerned that they're aging in this area and they might be a candidate for a neck lift. And that entails incisions that start just at the lower half of the earlobe here, wrap around the earlobe, and then you hide them all the way in this sulcus up to almost the top of the ear and then out into the hairline. That allows the surgeon to come underneath the skin, free up that tissue underneath the skin and reset it, pulling it back with dissolving sutures. And then you trim away the extra skin and sew that down into position. I do those surgeries under IV sedation, sometimes general anesthesia, depending upon what the anesthesiologist feels might be best for a patient. I do it in a surgery center that's fully accredited as an outpatient. Surgery takes about 2 to 2.5 hours, and then you're in recovery room for about an hour and a half. You go home after that. I usually send the patients home the first day with a large head wrap, just for the first day, and then they come back to my office the following day where we take off the wrap and then put the patient into a kind of a compression garment that you can put on and take off anytime you want. You can shower the next day. Sutures that wrap around the ear, there are sutures that are under the skin and dissolve in several months. And then there's this layer of stitches that are permanent stitches, but we take those out in about a week. So patients tolerate that very well. I get very little swelling, very little bruising with the procedure. Most patients really want to talk about downtime. How much time am I going to be off of work or exercise or family activities? Most of the time I tell them there's no exercise or housework for about 3 weeks, depending upon what type of job you have. If it's more of a sedentary job, most patients are back to work in about 2 weeks. If it's a more physical job where you're lifting and moving a lot, then it might be a longer, maybe even 4 and 5 weeks.